Flu is a common viral infection that can be deadly, especially in high-risk groups. The flu attacks the lungs, nose, and throat mostly, and children, older adults, pregnant women, and people with chronic disease or weak immune systems are at a higher risk. This Children's Day, we have with us in our Facebook Live session Dr. Harish V.S., pediatric pulmonologist at Apollo Medical Center, Karapakam, Chennai, to enlighten us about flu in children. Good evening, doctor.
Hi, good evening.
What is influenza or flu, doctor?
Influenza or seasonal flu is it's a very serious infectious illness of affecting the body, caused by many types of influenza virus.
And what are the symptoms of flu, doctor?
Symptoms of flu, seasonal flu, can be like any other symptoms of flu with sudden onset of high-grade fever, sore throat, cold, cough, body aches, headaches, and sometimes even diarrhea and vomiting.
How does the flu spread, doctor? Today, kids go to school, they sit next to each other, and one kid gets a cold. I mean, almost the entire class tends to fear of the flu spreading.
Normally, flu spreads from one person to the other when a child or any person is exposed to infectious droplets because of coughing or sneezing. The child can come in contact with. Now, these droplets will have the flu virus, and when you either inhale or you come in contact with the secretions of these cough and sneezes, the person can get infected. And sometimes even coming in contact with surfaces which are infected with the secretions of respiratory secretions of children who are not well with flu, you can still contact illness by touching these secretions and putting your hands in the nose or mouth or in other parts of the body and not washing your hands properly.
And what are the complications associated with flu?
The most common complications are pneumonia and ear infections as well. Now, 25% of children with seasonal flu have concomitant ear infections, and if the flu virus is quite deep-seated inside the lungs, it can also cause viral pneumonia, and where they can have a lot of secretions inside the lungs, which can also lead to secondary bacterial infection requiring antibiotics other than the antiviral medication.
Secondary bacterial infections. Could you please elaborate on that, doctor?
Yeah, when you have secretions in your lungs, it's always a place where, other than the virus, the bacteria can also multiply, and therefore it can lead to complications of the flu.
And how do we prevent this seasonal flu?
Yeah. The most important step to prevent seasonal flu is to vaccinate yourself at the right time. The second important step is, if you're exposed to somebody with flu, try to stay a little away from that person, because flu can spread within a diameter of 2 meters if the person coughs or sneezes on you, and be away from crowded places, and also use tissues to catch your cough and cold, and try to bin it instead of using handkerchiefs where you're going to carry the virus along with the handkerchief until you start washing them.
There is a stress on the importance of vaccination today for flu, doctor. Could you please elaborate on that?
Yeah. So recently, vaccines have come out for seasonal flu, especially the swine flu and influenza B. So vaccines have been quite effective to stop the transmission from one person to the other. Nearly 60 to 80% they are effective. We have intranasal flu vaccines and injections, and it does prevent flu to some extent, but sometimes because of various changes in the types of flu from season to season, these vaccines may not work to some individuals.
And why should children have the flu vaccine specifically?
The highest amount of exposure that can happen to anybody are children, especially at schools, daycares, nurseries, and and their immune system are anyway not very good as compared to the adults and the older children. So that's why children are a high priority to get vaccinated. However, medically we say there are children that there are some children who have medical conditions like cardiac, liver, asthma, and all these children are high priority to be vaccinated compared to the other normal children.
And what are the benefits of this vaccine, doctor?
So when you get vaccinated, even if you are exposed to flu, the seasonal flu, or when you come in contact with a body fluid which has got the flu, your antibodies which are already being produced uh, because as a result of vaccination will help you to fight the virus. And even if you get manifestations of the illness, it may be very minimal, and you can certainly tolerate it better.
Are there any side effects of the flu vaccine, doctor?
Just like any other vaccination, all vaccinations have minimal side effects. I'm sure the doctor is going to tell the patient just before giving the vaccines. So, in flu vaccines, when you administer them, you have injection site pain, body aches, muscle pain, fever, and other complications, severe ones, which very rarely happens, like anaphylaxis or also called as vaccine allergy, where the patient can also collapse. But this can happen for any vaccination. It's just not flu vaccine.
A lot of parents mention that my child had fever post the vaccination. Is it normal?
Having a fever post flu vaccine is quite normal and usually doesn't last for more than 48 hours, and it requires simple paracetamol. Anything that goes beyond 48 hours, always go back to your doctor, check whether it is related to swine flu or the flu vaccination, or is it something else which has coincidentally happened along with the vaccination.
You mentioned about children who should be prioritized for flu vaccination. Are there any category of children who shouldn't get the vaccine?
Children under 6 months medically are not being licensed to get the vaccine, number one. There are children who have, when they have fever and during a fever illness, febrile illness, they are not supposed to have the vaccine. Number two, just this is a contraindication for any child having a fever. They shouldn't have a vaccine. Number three, if a child has had an experienced allergic reaction to the same flu vaccine in the past, then probably it's not right to have the vaccine.
Is the flu vaccine needed every year?
Now, flu virus is so notorious that it keeps changing its um, antigens, and therefore the structure, antigenic antigens means they are molecules that are found on top of the flu virus, which maintains a distinct identity for each subtype. So when the antigens keep changing, the vaccine also keeps changes because the old vaccines don't work for the new kind of subtype.
What are the myths associated with the flu and the flu vaccine, doctor?
See, flu generally the myth is you get exposed to flu, you get immune to flu. But in terms of influenza, every exposure it can be a different type of subtype, and every time you get exposed, you can get quite ill. So that is another important myth that is not right.
What is the best time for children to get the flu vaccine? Like pediatricians generally tell us October, September December varkulla போட்டுடுங்க அப்படின்னு. What do you think is the...
So generally, flu viruses survive better during the winter months and the colder months. So wherever you go, any part of the hemisphere, just before the autumn starts, we always advise patients to come and get your flu shots. So the best time would be sometime between August, September to trying to finish off your shots before November.
And is there a difference between a cold and the flu? How do parents identify the difference between the two and approach a pediatrician at the earliest?
So both the cold and the flu they have similar symptoms like sneezing, cough, cold, fever. However, for flu, which means seasonal flu, that's what we're talking about, you generally have sudden onset of fever and they are high grade fevers and the child will generally be sick looking and child can be dehydrated. They have severe headaches, body aches, which generally is not very common with a normal cold, normal viral fever.
Is it true that flu vaccine causes febrile seizures in children under 5?
Now, there might be a few children who have had a flu vaccine and they have had a febrile convulsion or febrile seizure. Most likely, the scenario would have been for any those children who have had the seizure would have been in a bracket age between 6 months to 6 years, where they have had a fever and they could have had a convulsion or a seizure. So, if these children are genetically prone to have a seizure, and unfortunately, it was as a mere coincidence at the time of flu vaccination, you have had a seizure as well. However, um, fever itself can cause a seizure rather than the flu vaccine per se.
My child is suffering for the last 3 days with cold, fever, and flu. She has a lot of body pain and headache. The chest is also heavily congested with a lot of cough. Kindly help me with a solution.
Right. If your child is quite sick and not drinking, the chest is having a heavy cough, first thing is head to your pediatrician. You can carry on with your home remedies, but however, head to your pediatrician, get the child's chest or check by the pediatrician. If the child is sick and very ill looking, there's a high chance in the flu season that child needs to be checked for swine flu.
Our next question is about the swine flu, doctor. What are the symptoms of swine flu and how similar is it to the normal flu?
Symptoms of swine flu and the normal flu are pretty much the same, but in swine flu, the fever, the body aches, the throat pain, all that could be a very high degree symptoms, and generally the child will be very sick looking and dehydrated, and the high grade fevers are even up to 103, 104, and that's how they are different from the normal flu.
Is it safe for children to have the influenza vaccine at the same time as their scheduled childhood vaccines?
So as per the advice given by Indian Academy of Pediatrics, all flu vaccines can accompany with the other normal vaccines.
My child is 4 years old and he still has got a flu even after receiving the vaccine. What could be the reason?
Now, it's very important to know your flu vaccine is going to help to prevent only influenza and that too certain types of influenza and not the common cold. There's so many other viruses out there which can cause the common cold and or the normal flu which cannot be prevented. No matter how many times you have taken the flu vaccine every year or every other year. So the take home message would be your flu shot is to prevent only influenza, that is swine flu, influenza A, influenza B, two subtypes are there. And those are the only notorious ones which can be prevented.
Hello, doctor. My two kids, aged 9 and 4, are diagnosed with swine flu last month and had been admitted and have been given medication for 8 days. Is there any chance that it could recur, as in the swine flu could recur? Because my daughter is having the same cold and cough all over again.
The same cold and cough could be because of other viruses as well. It need not be swine flu. However, you can have other varieties of influenza like influenza B, which can affect the child in the same season, or other varieties of influenza A. So always go and get your child checked with the doctor, whether it could be the another episode of swine flu or whether it's a normal cold which cannot be prevented.
How effective is Vaxi-Flu and Tamiflu? Are they both the same and can they be used?
Tamiflu can be used mainly for treating swine flu, and we give it for a period of 5 to 7 days, and it's found to be quite effective. However, when there are complications because of swine flu, we have to deal with those respective complications and carry on with the Tamiflu.
What are the preventive measures from the flu spreading in our family, doctor?
So, in the same household, generally it's a thumbs rule that you one person gets the flu, the other all the other family members do also get it. However, there are certain measures which can be taken. Um, Wearing those N95 masks is a good measure. Getting your other family members vaccinated is also a good measure. However, the vaccines take about 2 or 3 weeks for it to start working, and then when one family member is being treated with Tamiflu, the other family members who do not have any symptoms and who are prone to because the exposure, they are given preventive treatment once a day for at least 10 days until the index patient or the family member is completely treated.
My son, aged 7, has a viral fever starting last 8th of November, and the temperature has been nearing 101 every 6 hours. And I have taken him to my doctor, and he's still not recovering completely. Could it be the swine flu, or could it be a normal flu?
I'm afraid in this scenario we need to examine the child, then we'll take it from there.
Why do colds and flu increase during winter, doctor, specifically?
It's medically proved that the viruses survive better during the cold season, and uh, in the summer season the viruses survive much lesser, and the transmission is also much lesser because it's hot during the summer season. That's one of the main reasons.
Should I keep my child at home more often if she hasn't been immunized?
It's not ideal to not to it's not ideal to isolate somebody if they are not immunized. But I would advise during the flu season, try to get your child immunized as early as possible. And it is important that child should socialize, go to school, and mix with other people as well at the same time.
Hello, doctor. We hear that consumption or intake of vitamin C during the last few months of the year helps prevent flu. Is it true?
Vitamin C, yes, it builds up the immunity to some extent. It helps to prevent the normal colds, the normal viral colds and fevers. But when we have an outbreak of swine flu happening or in other varieties of influenza, unless we take the universal precautions of stopping the flu spreading, like covering yourself when you cough and sneeze, so that the next person doesn't get, we can't prevent these kind of flus in spite of taking good amount of vitamin C. But that doesn't mean that you should stop taking vitamin C. I think that's a good idea to take vitamin C, especially not only during the winter but throughout the year.
Hello, doctor. My son, aged 3 years, has repeated sessions of cold continuously, and he has sneezing. His eyes turn red with scratching and irritating with a minimal weather change. This type of problem has never happened before, and he also had a seizure once. What could be the issue?
The seizure could have been because of he falls in the bracket of febrile convulsions. However, if it's just without the fever and sneezing episodes, the child needs to be tested for other allergic conditions. So taking him to the pediatrician would be very very ideal. Get him examined. Yeah,
Is it okay to get a flu shot when I have a cold?
that's absolutely fine. No harm in getting a flu shot. The only thing that says no is when you have a fever.
We hear about a lot of home remedies. A lot of viewers of ours have asked about home remedies to treat flu, doctor. What could be the basic home remedies they could do before approaching a pediatrician?
See, right from using turmeric milk and you name it, there are lots of home remedies are there depending on which cultural background people are coming from. There is no harm in carrying on with the home remedies. However, if the cold is going on for quite some time, or there are high grade fevers which are not fitting into the definition of the normal cold, then I think it's important to get your child checked with your pediatrician, and then the pediatrician will tell you whether those home remedies could continue or not.
Can a swine flu affected child be treated at home with antiviral medicines? What are the signs to get the child admitted in the hospital for closer observation?
Now, every child coming in with swine flu need not be admitted. Uh, I would advise you leave it to the doctor to decide. However, if the child is not taking enough fluids, the child is getting dehydrated, and the parents are extremely anxious, they're not able to control the temperatures, and the child is very sick looking, and those are the important things where a child usually gets admitted for treating swine flu. Majority of them are treated at home.
How do I know if my child is at risk and should be given the flu shot?
Every school going child, um, although it is not a compulsory vaccine, it's important that the child is, when the child is exposed to lots of coughs and sneezes around in a classroom, he or she has got every chance of catching the influenza virus, especially in a season. So I would advise most of them to get your child vaccinated just before the flu season starts.
Hello, doctor. My father is down with swine flu and pneumonia, has now recovered, and now my mother is also having swine flu and has been hospitalized. What is the risk of my child also getting the swine flu?
Yes, the risk is high. If your child is not having any symptoms as we speak, it's important the child is put on preventive treatment at least for 10 days. And when the child, if at all the child has any symptoms of cough and a cold and a fever, it's very important to take your child to the pediatrician immediately.
My child will turn 6 months this 25th. I have to get her vaccinated for influenza vaccine on that day. Can it be done a month or two later?
Certainly, not a problem. Um, there is no anybody 6 months and above can get vaccinated for swine flu. However, keep a watch on the season right now. If there's an outbreak of swine flu happening, the more you postpone it, the more your child is at risk of being exposed.
Hello, doctor. I read somewhere that the potency of the vaccine for influenza would be only for a year. Is this for H1N1 vaccine or for influenza as well?
See, influenza itself, you have three varieties: type A, type B, type C. In type A, we have several varieties, including one of them is H1N1. The other one is H3N2. So this H1N1, H3N2, and influenza B2 subtypes. These are the four viruses that are covered by the swine flu vaccination, which is the quadrivalent vaccine that's coming out right now. The other subtypes are not covered, unfortunately. So I think getting vaccinated will cover only these four subtypes and not the other ones.
I am confused whether to give my 7-month-old a flu vaccination as it is listed as optional in the vaccination schedule. I live in Chennai and have not seen anyone around me immediately suffering from influenza in the near past. Kindly advise.
The word optional itself is quite tricky. The moment a person hears it optional, they always think it should be really needed. But abroad in US and UK, people go to their clinics voluntarily and get their flu shots. However, the high risk group children are advised to have the flu shots compulsorily, and these high risk groups are children who are very young and children who had background medical illnesses like wheezing, asthma, liver disease, heart problems, and these children, if at all they get swine flu illness, their medical problem not only gets exaggerated, but they also get very unwell.
Hello, doctor. My child is allergic as whenever weather changes, and she gets troubled by dry cough. And doctor suggests an anti-allergic and antibiotic every time we consult. Should I get the influenza vaccination?
If you're prone to allergy, that means your lining of your respiratory tract probably is producing more mucus and secretions. So, getting a flu shot every year is not a bad idea, because basically what happens when you have exposure to flu influenza is, again, there's more secretions happening in your airway tract, and you already have a lot of secretions because of allergy. So the child might have more complications. So that is why children with asthma and wheezing episodes, we always advise, please always get yourself vaccinated for swine flu every year.
Is it necessary for every child to get the flu vaccine?
It depends on what the parents take it like. If you're exposed to, like if you're there in the healthcare industry, and you have family with children, then certainly get them vaccinated, because it's the healthcare workers who are at the forefront to get infection. And if children are exposed, they get highest exposure in their schools, daycares, and nurseries. So I think in the years to come, flu vaccination will start becoming necessary rather than optional.
My daughter is 5 years old, and she often has a cough which slowly and rapidly turns into whooping cough, especially during winters. Is it the early sign of asthma? Number one. She's given azithromycin syrup, but she gets relief only after a round of, or maybe maximum 3 rounds of nebulization. She has not been given majority of her vaccinations. Could this be one of the reasons? And the doctor has strongly advised for influenza vaccine. My question is there a single dose of vaccination which can cover all the previous leftover vaccinations?
Uh, I think it looks like a case where the child needs to be seen with the doctor. We have to go through your vaccines that are being given. If there is a pertussis like whooping cough every time the child gets ill, then certainly that we need to go through whether pertussis vaccination is being complete. And it has to be, it should be taken case by case, and examining the child and looking into the vaccine chart.
Hello, doctor. I'm 14 weeks pregnant. Should I also take, or can I also take the influenza vaccine?
As far as I know, there is no contraindication of influenza vaccine in pregnancy. So kindly check with your obstetric doctor and get yourself vaccinated.
Today is Children's Day, doctor. What is your message to our viewers today?
So yes, winter time in Chennai, the weather gets a little gloomy, but much pleasant and better. That's the time where children get their winter holidays. They enjoy very well. I would advise to get most of the children vaccinated with swine flu, or in other words, influenza vaccine, so that the transmission of the viruses gets much lesser if you vaccinate yourself. However, it's important that parents have to teach every child their hygiene measures, that not to cough and sneeze on each other, but to catch them in a tissue and bin it so that it doesn't spread to others.
Thank you very much for an informative session, doctor. For appointments with doctor, you may reach out at 044 3070 7110. I repeat, 044 3070 7507 and 3010 7110. Thank you, doctor. Thank you, viewers.
Thank you, viewers.